At MaxWell, we know when we clean the blood, the body and brain work better. Hi, I'm Dr. David Haase with MaxWell Clinic, and I'm here to explain our HOPE protocols. But before we dive into HOPE, it helps understand the proven foundation of therapeutic plasma exchange, or TPE. TPE has been used for more than 7 decades, since the 1950s, to treat conditions like myasthenia gravis, Guillain-Barré syndrome, and severe autoimmune flares. Standard TPE focuses on removing harmful plasma components and has a long record of clinical benefit. HOPE, which is Habitat Optimizing Plasma Exchange, is our advanced form of therapeutic plasma exchange. It takes the proven foundation of TPE one step further. While classic TPE subtracts toxins, autoantibodies, inflammatory proteins, and senescent signals, HOPE also replenishes the plasma with a personalized blend of albumin, antioxidants, electrolytes, and regenerative cofactors. In other words, we don't just clear out what's dragging you down, we give the body the nutrients and materials it needs to rebuild. If you or someone you love is dealing with memory lapses, persistent brain fog, complex autoimmune issues, toxin overload, or you simply want to optimize health, you're in the right place. In this video, you'll learn exactly what HOPE is, who can benefit, and how to begin. Think of your bloodstream like the soil of a garden. Over time, that soil can become polluted, clogged with debris, inflammatory proteins, heavy metals, persistent organic pollutants, and more. Traditional plasma exchange scrapes away the worst of it. HOPE goes further, returning your blood cells in a nutrient-rich solution that supports stem cell activity, immune balance, and overall vitality. So, how does HOPE work? The human body is inherently designed to heal. Habitat Optimizing Plasma Exchange enhances that natural ability by removing harmful substances circulating in your plasma and infusing fresh components that promote stem cell rejuvenation and tissue repair. Each element we remove or add has the power to shift your body's internal signaling towards health and away from degeneration. Here's how we do it. We completely remove, deeply clean, and optimally replace. So first of all, completely remove. Using an IV tube, we draw blood from a vein in the arm, mix it with a preparation formula, and guide it into our state-of-the-art apheresis machine. We deeply clean. Once the blood is inside the machine, your aged or polluted plasma, laden with inflammatory markers and toxins, is separated from your blood cells. The blood cells are preserved while the old plasma is discarded. Then we optimally replace. The blood cells are then combined with an individually formulated solution that may contain various proteins, growth factors, and other biological components to turn on the body's natural regenerative processes. This cleaned and optimized blood is then returned to the body, providing all your cells with a healthier liquid soil. Ultimately, HOPE combines the established safety and efficacy of traditional plasma exchange with a continuously improving, personalized optimization strategy. By restoring a healthier internal environment, we're giving your body the best chance to thrive. And that's the real promise behind this therapy. We've organized HOPE into 4 distinct protocols. First of all, HOPE for Brain Health is designed to support cognitive clarity, helping with early memory loss, mild cognitive impairment, Alzheimer's disease, and lingering brain fog. Before and after the 6 exchange series, we run comprehensive assessments looking at cognitive screening and neural response tests, vascular and metabolic labs, and Alzheimer's-related biomarkers. We test to objectively track each patient's progress, refine their personalized plan, and demonstrate real improvements. Next, we have HOPE for Autoimmune. This targets chronic inflammation and supports immune rebalancing in complex autoimmune conditions. Before and after the series, we assess immune activity, systemic inflammation, oxidative stress, and microvascular function, so you have objective data to guide supplementation and measure restoration. Next, we have hope for detoxification. This flushes built-up environmental and metabolic toxins to restore systemic resilience. Pre- and post-testing evaluates toxic burden, vascular function, and key metabolic markers, providing a clear before and after picture of toxic load reduction and system recovery. And finally, hope for longevity is a quarterly reset that seeks to elevate energy, enhance performance, and slow biological aging. Before each series, we assess microvascular health, internal age indicators, and key metabolic markers, and reevaluate 1 month after the second exchange to track shifts in biological aging and vitality. As you can see, each protocol is built with purpose and precision. From the number of exchanges to the supplements and follow-up testing, every element's designed to support your specific goals, whether that's restoring cognitive clarity, calming chronic inflammation, eliminating toxins, or enhancing longevity. With targeted assessments before and after each series, we're able to measure what matters so you can feel confident in your progress and empowered on your path to better health. Over the years, we've seen some remarkable transformations in patients who've undergone plasma exchange. Some regain sharper memory and mental clarity, others notice reduced joint pain and inflammation, and many report a surge in their overall function and vitality. For individuals managing chronic conditions, these changes can redefine what daily life looks like, allowing them to reclaim more independence, pick up hobbies they thought they'd lost. We've also observed improvements in measurable biomarkers like decreased inflammatory markers and more robust immune function. Hope is not a quick fix. It's about giving your body the opportunity to deeply heal and flourish. When you cleanse the internal environment, cells function more efficiently, which can unlock a whole new level of health and resilience. We're proud to have been leading the way for the greater part of a decade in this remarkable field, partnering with top researchers, great clinicians, and amazing patients to expand what's possible for humanity. By optimizing our internal environment through habitat-optimizing plasma exchange, we have new hope for better health, resilience, and longevity. If you're ready to learn if hope is right for you, visit maxwellclinic.com/hope or call 615-370-0091. One of our Hope coordinators will answer your questions and help you take the next step. At MaxWell Clinic, we believe everyone deserves more good days. Hope offers a data-driven way to reset your health, reclaim the vitality, and live a richer, more resilient life. Thank you for watching. Here's to more vibrant days ahead.